Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Common infant and newborn problems. Introduction. Having a sick baby can be very difficult. At some point, most parents must deal with a sick newborn or infant. There are some common health problems, skin problems, and infections that may affect your baby. Many of the problems your baby will face are not serious. However, it is important that you know how to care for your sick baby and how to recognize the warning signs of more serious problems. This program will help you better understand common infant and newborn problems. It covers health problems, skin problems, and infections. Also included is information on when you should contact your child's healthcare provider. Infants and newborns. Going home with a new baby is exciting. However, it can also be scary. Newborns have many needs, like frequent feedings and diaper changes. Babies also can have health issues that are different from older children and adults, like diaper rash and cradle cap. Many of these problems are not serious. However, it is important to know how to help your sick baby. It is also important to know the warning signs for more serious problems. The following sections look at common health and skin problems seen in infants and newborns. Another section focuses on common infections in infants and newborns. Health problems. There are some health problems that are commonly seen in infants and newborns. Coughing in infants and newborns may just be that, a cough, but coughing may also be caused by asthma, allergies, or certain infections. Sometimes a cough is a sign of a more serious health problem. For example, coughing may be a sign of gastroesophageal reflux, or GER. GER is common in healthy infants. GER happens when stomach contents reflux or back up into the esophagus during or after a meal. Many babies with GER cough, spit up, or vomit. GER may cause a baby to refuse to eat and not gain weight. If your baby coughs often, you should talk to your baby's healthcare provider. It may be a sign of GER or a more serious problem such as whooping cough. Vomiting is another common health problem in infants and newborns. If your baby spits up every so often, this is normal. However, frequent vomiting is not. Keeping your baby upright after feeding may help lessen your baby's vomiting. Also, try to feed your baby smaller, more frequent meals. Contact your baby's healthcare provider if your child is not gaining weight or has other signs of illness. Sometimes vomiting in infants and newborns is a sign of a more serious problem. A fever is the body's way of fighting infections. Not all fevers need to be treated. However, high fevers in infants and newborns require medical attention. You should contact your baby's healthcare provider or go to an emergency room if your infant is 3 months or younger with a rectal temperature of 100.4 degrees Fahrenheit or higher. Your infant is older than 3 months with a fever of 102.2 degrees Fahrenheit or higher. Colic is another common problem in infants and newborns. Colic may be caused by pain in the abdomen. The pain may be caused by intestinal gas or an obstruction in the intestines. If your baby cries for more than 3 hours a day at least 3 days a week for more than 3 weeks, he or she may have colic. A baby with colic is otherwise healthy. There is no obvious cause for the baby's crying. Fortunately, colic usually goes away on its own by 3 months of age. In the meantime, try to find ways to soothe your baby. Try singing to your baby or giving him or her a pacifier. Jaundice is very common in newborns. It causes a baby's skin to look yellow. The whites of the baby's eyes may also turn yellow. The yellow color is caused by a buildup of bilirubin. Bilirubin is a substance that is made in the body during the normal process of breaking down old red blood cells and forming new ones. Normally, the liver removes bilirubin from the body, but for many babies, in the first few days after birth, the liver is not yet working at full power. This results in jaundice. Babies born with jaundice have an increased risk of complications that can lead to mental disabilities, deafness, and other long-lasting problems. Fortunately, most cases of jaundice go away without treatment and are not serious. If your baby's bilirubin level is very high, your baby's healthcare provider may recommend phototherapy treatment. Phototherapy treats the extra bilirubin with a special light. The light changes the bilirubin in the skin and makes it easier for the body to clean it out.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Skin problems. Skin problems can also affect infants and newborns. This section reviews some common skin problems. Diaper rash causes inflamed skin around the diaper area. It is common in infants and newborns and usually happens due to sensitive skin. To avoid or heal diaper rash, you should change your baby's diaper often, apply diaper ointment, wash cloth diapers with fragrance-free and dye-free detergents. Call your baby's healthcare provider if the diaper rash gets worse or doesn't go away after 3 days. Sometimes a rash may require a prescription. Another common problem seen in infants and newborns is cradle cap. Cradle cap causes a baby's scalp to develop scaly patches. It isn't serious. If your baby gets cradle cap, washing your baby's scalp every day may help. Make sure to use a mild shampoo. Melia are small white bumps that may form on your baby's nose, cheeks, or chin. Melia are common in infants and newborns and are not serious. Epstein pearls are also common and look similar to melia. However, Epstein pearls form in the baby's mouth. Baby acne is acne on a newborn's cheeks, chin, or forehead. It is common and temporary. Treatment is not needed for melia, Epstein pearls, or baby acne. All of these skin problems will usually clear up on their own. Infections. Some infections are commonly seen in infants and newborns. This section reviews a few of these infections. Common colds are often seen in infants and newborns. These are viral infections that settle in the nose and throat. Usually infants and newborns with a cold have congestion and a runny nose. Most colds are not serious. However, in babies younger than 2 to 3 months of age, a cold can quickly become something more serious, such as pneumonia. Infants this young should be taken to their healthcare provider if they have a cold. Respiratory syncytial virus, or RSV, is another common viral infection in infants and newborns. RSV infects the lungs and breathing passages. RSV may be more serious in infants than in adults. Your baby may need to stay in the hospital for treatment. Treatment involves keeping your baby hydrated and making sure your baby can breathe easily. Ear infections are also common in infants and newborns. This is because of the way a child's ear is structured. Ear infections may be caused by bacteria or viruses. A baby with an ear infection may cry and pull at his or her ear. If you think your baby may have an ear infection, contact your baby's healthcare provider. Sometimes ear infections require treatment. A very common infection in infants and newborns is oral thrush. Oral thrush is caused by an overgrowth of yeast in and around an infant's mouth. Oral thrush is most common in babies younger than 6 months old. Babies with oral thrush will have white patches on their lips, tongue, or inside the cheeks. These patches look like cottage cheese. Contact your baby's healthcare provider if you think he or she has oral thrush. Most cases of thrush will go away on their own. However, sometimes an antifungal solution is needed. When to seek medical advice. One of the toughest things for new parents is figuring out when to call your baby's healthcare provider. As a rule of thumb, trust your instincts. If you think something is not right, you should always call your baby's healthcare provider. Even small changes in your baby's eating, sleeping, and crying habits can be signs of a serious problem. Contact your baby's healthcare provider if your baby has loose or watery stools, is not dirtying as many diapers as normal, vomits frequently or after feedings. Also, contact your baby's healthcare provider if your baby has a cold, a rash, a red or sore navel or penis, eye discharge, fluid draining from the ears. Infants under 3 months of age with a fever of 100.4 degrees Fahrenheit or higher should be seen immediately by a healthcare provider. Contact your baby's healthcare provider if he or she is older than 3 months and has a temperature higher than 102.2 degrees Fahrenheit. Seek emergency medical care if your baby is experiencing seizures, having trouble breathing, unable to move, unresponsive. Also seek emergency medical care if your baby has a stiff neck, bleeding that won't stop, blood in urine or stools, head injuries, large burns or cuts, skin that is blue, gray, or purple.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Having a sick baby can be very difficult, but it is bound to happen sometime. There are some common health problems, skin problems, and infections that may affect your baby. Many of these problems are not serious. However, if you are worried about your baby, call his or her healthcare provider right away. As a rule of thumb, trust your instincts. Even small changes in your baby's eating, sleeping, and crying habits can be signs of a serious problem for infants and newborns.
Thank you for using Explain.